everyone, and welcome to our Abstracts and Tracks webinar, where we're going to give you all the updates about what's going on with USCHA, the abstract process, and our tracks. And I hope that everyone is doing well and taking care of themselves during this COVID-19 pandemic. And I also want to introduce myself. I'm Allison McKeithen, the conferences manager, and I'm here joined by Ace. You want to intro yourself?
Hi, I'm Ace Robinson, the Director of Strategic Partnerships and the Center to End the Epidemics. My real focus on the work that we do is how are we going to address those health disparities that we are seeing in particular communities, especially racial and ethnic minorities, and trying to make sure we uplift everyone as we move forward in the land of HIV and associated illnesses. Thank you for the invite, Allison.
Damian?
Hello, everyone. Hi, my name is Damian Cabrera, and I'm the program manager for the treatment division.
Great. And Joe?
Good morning, or good afternoon. Thank you, Allison. My name is Joe Juan Raquelto. I'm the Director of Government Relations and Public Policy for NMAC.
Thank you. And we're also joined by our other colleagues who are invisible, but yet they're still present. We have Chip, our Director of Communications, Shantae Gray, our registration manager, and we have Tara Barnes Darby, the Director of Conferences, and they'll be on as well, answering your questions and helping make sure things move along smoothly. So before we move on, I just want to do a few housekeeping things. First, I want to let you know that you have a GoToMeetings toolbar to the right. And in that toolbar, you'll see a chat and questions box where you can put your questions throughout the webinar. Feel free to enter them as they come, as you have your questions. If they can be answered immediately, we'll have someone respond. And if not, we'll get to them in the questions and answers section. And also, we want to let you know that question and answer period will happen once we finish the majority of the content for the webinar. Then we'll also be recording this webinar. So if you missed something, if something was just kind of moved on too fast, you'll have the options to go back to it later. It'll be on our website, uscha.life. So please make sure you go back if there's any information that you didn't quite catch this first time around. All right, so before we begin, I also want to do a roll call. Who's joining us? Please put your name and organization in the chat or questions box so we can see who's here. So we'll give you a few minutes to do that. Hopefully some people are rolling in and checking us out because we have a wide range of people. I think we had over 100 people registered today. So I'm glad you're all here and checking in and looking forward to getting some information about these tracks and abstracts. So I'll check. Chip, has anyone put the information in our box?
A lot of people
Really?
checked in. We
Who's
have
with
Oscar
us?
Marquez. We have Oscar Marquez from PCDC. We have Justin from Diverse and Resilient in Milwaukee. We have Sarah Duran from Family Health Centers of San Diego. Russell Campbell from HANC. Jonathan Albright Williams from Virginia Department of Health. Tammy Hout from Iowa. Sierra Brown from Cornerstone Family Health Care in Newburgh, New York. Asha Wilkes from the CDC. Wayne Johnson from the CDC Division of HIV, Mary Bergeron, UAB CFAR and 1917 Clinic. A lot of folks signing in today.
Awesome. Thank you, everyone. I heard some very familiar names, and thank you all for joining us. I hope you get some great information today. So while we jump on in this, we wanted to talk about some of the changes that are happening to USCHA. Hopefully, you've all gotten information that we've gone virtual, which means we're going to have an online platform delivering you all the content information you need that you would typically get at our in-person conference. So first, we've gone virtual, and we're also going to update our dates. So now the conference is going to be October 19th through the 21st, but all the content will be available for up to a year after the conference is over. But just to give you a little more in-depth information and kind of orientation to what's going on, I'll show you some other things. So you may have attended our webinars we had that went over kind of what our virtual platform will look like, just to get you acclimated to what to expect. So the virtual platform is basically going to look like this. It's going to be very similar to this, where we have a lobby where all of our things happen. We'll have our breakout sessions, our exhibit hall, our lounges, information booths. So it'll be very similar to what you're used to at our in-person conference, but it'll be online. Still be great though. Also, we're gonna have, as always, an exhibit hall where you can meet all the exhibitors, where you yourselves might wanna also exhibit and show your content and information. We'll have swag bags where people can put their information, slides, PowerPoints in there and keep them for their own record keeping after the conference ends, or for the duration of the time that it's posted. So we're really excited that people can take this information with them and not just have it while they're in person. They can actually just download it straight to their laptops. And then, as always, we have our breakouts. And this year we're calling them semi-live breakouts because they're going to have some additional components that we aren't able to offer in person that we are going to have online. And that's where you come in. This is where our abstracts and tracks process comes in. So in addition, we've updated our submission deadline to July 17th. It's a couple of weeks away, but we hope that you have plenty of time to really rewrite or write those abstracts that you've previously submitted. We want to give you the opportunity to review our new tracks and see if your topics align with those tracks, or if you need to just do some additional work to rework your topics into those tracks. But we're really excited about the new tracks, and we're going to get into those in just a moment. But if you want to submit, you go to our website, which is uscha.life/abstracts, or select the abstracts tab, and it'll take you straight to all the information about our abstract submission process. And we previously did a webinar talking about the abstract submission process in a lot more detail than what we're going to do today. And there lists all the information from each of the steps and what information we're looking for, how to accurately and correctly write an abstract. So if you haven't seen that webinar, I definitely suggest you go to our website and check it out. It's got a lot of great information there. So let's talk about our submission process very briefly. We have a 4-step process. Step 1 is for the primary presenter, who is you, hopefully, to enter their contact information. So we want to get the best email address for you, make sure that we can reach out to you whenever we make our decisions. Step 2, you want to enter in your co-presenter information. Multiple people can be entered at that point, whoever's going to present with you on the webinar. We want you to make sure that you get their information in. And also step 3, which is optional, but we ask for you to submit any co-authors, people who help write this abstract. You have an opportunity to have their information listed there, but like I said, it's optional. And then we have step 4, which is the majority of the information and content of your abstract. So that's where we get into the descriptions, the objectives, and so forth. So that is a really critical part. And I'm just going to show you what we updated about our abstract information in our step 4 so that you can accurately update or write your new abstract. So originally, when we opened up our process many months ago, we had 2 presentation types. We had a workshop, which is an oral, interactive, in-person presentation, and then we had our poster presentations. But we're going virtual, so we've decided that we're not going to do that format anymore because it's not really going to work for what we're trying to do with this virtual platform. So what we are going to do, we're still going to have workshops, but like I mentioned before, they're going to be called semi-live workshops. The semi-live workshops are 60-minute presentations. The first 30 minutes is your didactic presentation, and then the second 30 minutes is a Q&A and discussion part. So we're going to pre-record the first 30 minutes so that the presenters have a time to kind of really get themselves together and put together their best presentation. And then at the 30-minute mark, we're going to go live, where we'll take questions, we'll have discussion in the platform where we can talk about the topics that were presented just previously. We want you to upload all your PowerPoints so people have them available before the presentation, so that during the presentation, if they have any content they need to go back to, they can do so live. And also, we're going to have a scheduled presentation time, so everyone will know when you as a presenter will be there to answer those live questions during the Q&A portion. So since we're doing this live virtual part, we also have a few requirements that we're going to ask of you as well. If you're going to submit an abstract for a workshop presentation, we need you to have a laptop or a desktop computer that has a mic and a camera. We definitely need you to have reliable internet, a quiet space, be able to present concisely because you only have 30 minutes. You have those 30 minutes. The availability to attend rehearsals and the recording of your presentation. We absolutely need you to have all your PowerPoints ready to upload on time. And you also need to be available for that scheduled presentation time. So again, our updated submission deadline is now July 17th. Visit uscha.life, click on the abstracts tab, and you'll access the places where you need to go to get all the information about your tracks and the system to submit your abstract in. All right, so let's get into the other big part that we changed. So we updated our tracks. So before we had a long list of tracks, a lot of different topics, but that was before COVID-19 hit and before our worlds just kind of got twisted and turned in all kinds of directions. And we have new responsibilities now and new priorities. So we wanted to take advantage of the time and really write some tracks that reflect what the current needs are in this current environment. So we've updated our tracks. We've changed them to race. We have a federal track, HIV prevention during COVID-19, HIV care and wraparound services during COVID-19, ending the HIV epidemic, our next steps, reaching communities hardest hit and hardest impacted by HIV, HIV policy and COVID-19, community organizing during COVID-19, expanded testing to include COVID-19, and track in Espanol. So now I want to welcome Ace in to give more of an explanation about the various tracks that he's going to be working on. Ace, throw it over to you.
Thank you, Allison. So as Allison alluded to, we all know that we are in a particular time in the time of this country where we're actually addressing some of the systemic racism that has impacted all of our lives. And the HIV movement is not immune to that. We have seen a lot of focus on how are we going to really change the work that is being done to support the communities that are greatly impacted by HIV, and understanding that many of the people who are coming into the clinics, the main issue that they're having to overcome to achieve optimal health outcomes is racism. So we're very interested in seeing some of the innovative work that is being currently done and that has been done to really mitigate the influence of racism for individuals who are racial and ethnic minorities, people who are who might be speaking different languages other than English, people who are also having that intersection between their race and their gender and sexuality. So there will mostly be looking for really great workshops that are going to drive home how are we going to get over these current hurdles and address things like anti-Black racism, anti-immigrant status, things that go with language justice that disproportionately impact racial and ethnic minorities, and also making sure that we are paying close attention to what is happening with our American Indian, Alaska Native compatriots out there as well. Next slide, please. Thank you. In addition, as you know, we last year began the federal Ending the HIV Epidemic Initiative, led by Health and Human Services by HHS. With that, as many of you know, there's been a coordinated effort from HHS, the CDC, the National Institute of Allergy and Infectious Disease. Now we also have added HOPWA, and the Indian Health Services, Office of AIDS Research. So what we're going to be doing through this track, we're going to be partnering with these federal entities so that they can share what they are doing through the 57 identified jurisdictions to reduce the impact of HIV through their 4-step process. So these conversations will be quite lively, and there's been a commitment from each of the divisions, involved with the ending the HIV epidemic, to make sure they're being community-centered with their conversations, but then also understanding the administrative piece of this, where we need to learn how the partnerships will go forward. And what some of the challenges have been, and of course, what are some of the successes. So we've seen from the Jumpstart program from 4 of the different jurisdictions, some work that's being done, and the implementation plans that will drive forward the EHE initiative have started to begin in certain jurisdictions, as they all must begin by the end of the year. Next track, please. So the EHE next steps vary on the other side. We want to make sure that we have tracks really focused on what is happening out in those 57 identified jurisdictions as they are responding to the federal plan, and how they're bringing that to life in each jurisdiction. So we're very interested in learning what is going well, how is community engagement going? What is the ability to implement things like the Ready, Set, Prep program? What are some of the opportunities that some jurisdictions have utilized for at-home testing? Especially in this new environment as we're responding to the COVID-19 pandemic, while also keeping a strong eye on how we're going to address the longstanding HIV epidemic. We're really looking to see how each jurisdiction is partnering with their whether other divisions, like their health equity divisions, places like their community-based organizations, and then also with the federal entities to get the work done. Next slide, please. Thank you. And this is a very important track. As you know, at NMAC, we lead with race. And what does that mean at NMAC internally, and what does that mean for those of us out in the field? How are we going to look at some of the innovative work that is being done to support those communities that are disproportionately impacted by HIV? So whether we're speaking about people of transgender experience, gender nonconforming individuals, people who use substances, people who have experienced homelessness or are street involved, racial and ethnic minorities, or gender and sexuality minorities. We really want to see what is happening in the field today, where someone is going to take some of the work that has been done in a place like Birmingham, Alabama, and that is something that can be transferable, some knowledge that can be given to people who are doing work in South Carolina, or what is the work that is happening in Seattle that might help guide some of the work that needs to be done in Chicago. So we really are trying to be focused on having submissions that are really driving home how are we going to support those communities who unfortunately are filling our clinics, and in the worst case scenarios, the people who are disproportionately impacted with HIV morbidity, people who are not able to make it with us. So we look forward to all your submissions through these tracks, and now I'll turn it over to Damian.
Hello, everyone. On the treatment division, we are leading 4 different tracks. One of them is HIV prevention during COVID-19. And basically what we are looking forward with this track is to keep the conversations alive about HIV prevention, because we know that with this current pandemic, everything has been focused on COVID. So we want to make sure that we keep those conversations alive. And particularly, we are looking forward to conversations about the barriers and opportunities facilitators that community-based organizations have found, academics, researchers, activists, people living with HIV, while navigating access to biomedical HIV prevention, condom distribution, and also to include new game changers like long-term injectables. We are looking forward to highlighting innovative ways to overcome those newly found challenges, but while also addressing the intersectionality with the new social norms of social isolation, social distancing, and its intersection with other STIs, HCV, and obviously HIV and COVID-19. And just to give you an example, we are looking forward to discuss how organizations have adapted to make sure that PrEP is available for new patients and how to continue PrEP for those that were already on PrEP, prescription for 90 days of medications, referral to other clinics, telemedicine, and just to make sure that we bring a space that knowledge can be shared to other organizations and people that are doing similar work. Next slide, please. Our second track is HIV care and wraparound services during COVID-19. And with this track, what we're looking for is to have a conversation about how can we use the infrastructure that has been already built for HIV care and services, but for COVID-19 patients. We are looking forward to focus on strategies that combine the tactics to end both epidemics. And we're looking forward to include perspective that recognize the impact of social determinants of health, people living with HIV, who are 50 plus, work safety, U equals U, and many others. And in the middle of this track is to focus on non-medical services that are key to increase the availability and effectiveness of HIV/AIDS treatments. And just to give you an example, we hope to have discussions around housing support, transportation, emergency financial assistance, therapy, substance abuse, and basically everything that goes together with making sure that the HIV treatment is effective. Next slide, please. So the previous two, one was around HIV prevention, the second was about HIV care, and this one is about HIV testing specifically, expanding HIV testing to include COVID-19 testing. And we will focus on the innovations that have been carried out to make sure HIV testing continues while including COVID-19, because we are in a historical juncture and we believe it's not a matter of choosing one over the other, but to tackle both epidemics that we are dealing with at this particular moment. So intersectionality and attention to health disparities will be key in what we're looking for and should frame the discussions around best practices, community protocols, linkage to care, and who are those populations that are mostly affected by these epidemics. And just to give you an example, some of those discussions could be around home testing for HIV and STIs, the impact of unemployment in the economic accessibility that is also impacting access to healthcare, insurance plan. How could COVID-19 contact tracing could also help ending the HIV epidemic? Also, the best practices for community engagement, mobilization, counseling, and also in this one and as in the others, to include those populations that are disproportionately affected by these epidemics, like African American, Latinx, Native American, and others. Next slide, please. And the fourth track that treatment is leading is the track in Espanol, and we see it as very important because for us it's an exercise of language justice. One of the conversations that we have had is that the information that has been available around COVID is mostly in English, so it is not accessible for those that have been disproportionately affected by the epidemic and who are monolingual, that only speak Spanish. So recognizing this, we want to make sure that we have these conversations entirely in Spanish. And we didn't want to design this track based on our own opinions. That's why we developed a survey to gather the input, the feedback from our constituents. And from the feedback we have received from the survey, what our constituents want to see are basically the topics that will be discussed on those other tracks. For example, prevention to HIV during COVID, HIV testing during COVID, HIV care and wraparound services, and also ending the epidemic. We also wanted input on which populations people wanted to see more information on. And we found that the interest is mostly on sexual diversity, youth, 50 plus, and transgender individuals. And we also asked who should be presenting for this track. And most of the people said people living with HIV, service providers, activists, and academics/researchers. Obviously, this is a guide. We want to receive a variety of proposals, and we are looking forward to giving you any feedback that you might need, and also to address any of the questions that you might have at the end. So thank you.
All right, so Joe, are you ready?
I am ready. Hello, everybody. So NMAC is pleased to present these two policy tracks. The first one, as with a lot of the other tracks, addresses the COVID-19 and the way it's going to affect HIV policy. So as the slide says, as COVID-19 continues to demand congressional action, and more importantly, federal funding, this track will look at the long-term policy and funding effects this will have on the EHE funding. Immunocompromised individuals who have become infected with COVID, so co-infection with HIV and COVID, depend on research and science. We are requesting that this track will also explore what Congress must do to address the co-infection while continuing its promise to ending the HIV epidemic by 2030. And we're asking that people look into strategic policy ways or strategic ways to affect the appropriations policy and research within the CDC. And we'll go on to the next track. And this track, piggybacking on the first policy track, we're looking at, as some of the leaders in our movement are retiring, are leaving the field because of years and decades of doing this work. We want to look at what community organizing around the EHE will require in the future. As more, NMAC is determined to train the next generation of community organizers, but a lot of that depends on the modern advocacy, the technology platforms that we now have access to, that we didn't have access to perhaps even 10 years ago. This track will look at, if I could be as simple as saying, how to modernize community organizing and advocacy in this era. Especially with the commitment to end the HIV epidemic by 2030. I believe those are the two policy questions. Yeah.
Great, thank you so much, Ace, Joe, and Damian, for your information and for those descriptions. Hopefully everyone has gotten some good information and has their questions lined up. Again, the submission deadline is July 17th. Visit our website, uscha.life, and click on the abstracts tab. You will find the track descriptions there. You'll see a sample abstract submission. You'll also see some information about the various types of abstracts you can submit. There's also the webinars there that we previously did on how to write an abstract and submit in our system. So please check that out to get that more detailed information about abstracts and track submission. I also want to encourage you to go to our website and see the previous webinars about our virtual process and what we're doing to go virtual and what that means for the organization and how we're moving forward with our virtual process. It's on our website, uscha.life. And so now let's see if we have some questions. So Chip, do we have any questions submitted from our attendees?
We do. The first one is for ACE. Will there be a workshop for long-term survivors who are additionally infected with other diseases such as diabetes, cancer, dialysis, along with HIV, and the impact on them financially, spiritually, and emotionally?
Two parts. The second part I'll turn over to Damian because he's leading the 50+ group. The track really focused on communities disproportionately impacted by HIV. There's, as most cases, a large parity between ensuring that we are directly supporting our elder sexuals, and especially our elder sexuals who are part of those disproportionately impacted communities, and coming up with innovative ways to support those individuals. Damian?
Yeah, so yeah, the short answer is yes. I think we, on the track of HIV care and wraparound services, that could absolutely be included.
Great. Next question.
I have a workshop idea that doesn't seem to fit in any of these tracks, but I think is very important. Psychosocial support to people with HIV who are isolated during the pandemic. I think they're asking to see which track that might fit into.
I need a little more
so the psychosocial
yeah.
for, yes. So as we know, one of the largest groups impacted with HIV progression are people who are living with brain health deficits. So individuals who are living with HIV/AIDS neurocognitive disorders. So that is that falls directly in line with most impacted populations.
Great. Next question.
Are you given a track or must you choose as you write your abstract submission?
The best thing to do is to read the track descriptions and select the track that your abstract best fits in. So of course, a lot of them are intersectional, a lot of topics cross multiple topics, but I say pick the one that you feel it best fits and aligns with and make that track selection. If it doesn't, internally we'll look at it and see if maybe another track review panel should review it, but choose the one you feel it best fits in. Next question.
Sure. Will attendees during the sessions at USCHA be viewable to potentially help with interaction, connection, and networking?
Yes. So the virtual platform that we're using has a lot of conversational aspects where people are able to communicate with other attendees. So yes, that aspect will be available. Next question.
Okay. My area of interest is community leadership. Which track would that fit into?
Community leadership. I don't know. I feel like that had a lot to do with the community organizing as we deal with leadership and leadership transition. Joe?
Yeah, I would agree with that it would probably go into community organizing.
Next question.
I think this next one is a suggestion for a track or a workshop, and please correct me if I'm wrong, whoever's asking this question. How does COVID-19 affect people living with HIV?
I don't know. That sounds like a treatment track.
Yeah, I think that it will depend on the perspective of the presentation, but I think that it could be included rather on HIV prevention or HIV care, or yeah, or expanding HIV testing even. But yeah, it could be included in one of those three.
Perfect. Next question.
As far as training for the next generation with NMAC, is there a particular place and date for someone who's interested to go, and are we looking at a certain age group?
A future date for what specifically? The
I think he's
training?
asking about Joe's about building leaders.
Oh, okay.
Could you repeat that then?
Sure. The question is, as far as training for the next generation with NMAC, is there a particular place and date for someone who's interested to go, and are we looking at a certain age group?
A particular date for people to go, I'm not sure I understand that. And for the age group, that's a great question. I would think that we would want to incorporate Generation X up to millennials. Maybe I have that backwards. I'm not in either category, but I think we would want to include Generation X, particularly getting the Generation X and millennials involved in advocacy and community organizing. But I don't understand quite the first half of that question.
Right.
So first one has
whoever wrote the question, let us know a little more detail. You can email me at amckeithen@nmac.org, and I'll try to get you some more information about what you're particularly looking for. But USCHA is open to everyone. The whole conference is a free conference for the first 4,000 people who register. So if you're interested in USCHA and attending that, please do that. But we do have a lot of programming that deals with building leaders. So you can also look at our website, nmac.org, to get more information about that. But email me and I'll see where I can best direct you to get some information about leadership. Next question.
are you looking for a workshop on community organizing around voting by mail and virtual tools to educate our community on voting rights before the election?
So a good question, because the turnaround between the USCHA and the election is so short. I don't know if that would be possible. But community organizing, I think, for the purpose of this track, we would want to look at how a community organizing would look in kind of a more modern technology way. Because I think one of the deficiencies we've seen is for people that are not in DC, how do they advocate using, for example, congressional offices in state, and using the leverage of their constituents on a state level. So it doesn't necessarily have to be federal, it could be state level, and how to organize around a state related issue that, while important on the federal level, it would be more germane on the state, if that makes sense.
Great. Next question.
Did I hear something about a swag bag like last year?
Yes, you did hear about a swag bag. So we are reinventing what swag bag is. We're taking it virtual. So this swag bag, because like everyone loves conference bags and all the great stuff that comes inside. So we're reinventing it for our virtual platform. So we're going to have availability is for you to collect all the information, PowerPoint. You can save webinars there that have previously been presented. Put all that inside your swag bag. You can download it to your laptop or email it to yourself. There are multiple ways to collect information. So there will be a swag bag for USCHA. Next question.
Is it possible to conduct a roundtable discussion virtually?
There are ways to conduct a roundtable session virtually. We are not formally offering round tables. We are offering the workshop format. So hopefully that'll help facilitate discussion. We are investigating other ways to kind of offer places for people to have conversations. So we're having our youth lounge, trans lounge, 50+ lounge. So we're going to have a lot of lounges and places in the virtual platform where people can convene and have those kind of conversations informally. So there'll be some places, just not formally in the abstract submission process. Next question.
Will you have someone discuss domestic violence during COVID?
That's an interesting topic. Has not specifically come up, but I'll definitely take that one down as something. I would say if you think that you have something to present on that, absolutely submit it. I kind of think it might be under most impacted populations. Ace?
Yeah, so when we're looking at individuals who have experienced domestic violence, physical, sexual, verbal, and individuals who have had other adverse experiences in their life, we do know that that is a population that we are specifically highlighting to make sure that we find the best way to support them, as we've seen very innovative ways to support people in those horrendous situations, even though they are sheltering in place. So I think we need to continue uplifting those best practices that have come up, as it seems like shelter in place might be around for a while.
And again, if I would also have to add that if it relates to HIV care, I think it can also be included on the HIV care and wraparound services, because we also want to have conversations about housing. And I think that domestic violence and gender violence has to do with accessibility to housing also. So, and the list of examples I gave is not, those are not the only topics that you can talk about. If domestic violence has to do, or the proposal has to do with HIV care, more than welcome to submit it under this track.
Great, thank you for that, Damian. And that's true with most of the tracks that we have. A lot of times it's impossible to list every single topic that will fall in one particular subject matter, but we are very welcome in opening in all those various tracks to the most specific caveats under each topic. So if something falls under HIV services, but we didn't specifically list it on the track description, doesn't mean that it's not included in there. It just means we had a small description window that we need to fit everything into in order to not have 5 or 6 pages of descriptions. So always you can email us or email me, amckeithen@nmac.org. That's AMCKEITHEN@nmac.org. Ask me your very specific question about your topic, and I'd be happy to give my best advice or recommend you to someone who can give better advice about which track it would fit into, or how to make sure that it meets in our track guidelines so that you get the best score possible. All right, next question, Chip.
What track is HIV testing services and HIV care services during the COVID-19 crisis?
Which track? Those are the track titles.
Mm-hmm.
Okay, next question. Young person wants to be recognized as emerging leaders. How are you helping to shape that?
We have a lot of programming around, we have a youth initiative at NMAC specifically that works with younger populations and building leaders within that population. I think that falls under the center.
Right. All right, so yeah, it's, I'm assuming separate from the conference is the question, but we relaunched actually yesterday our youth initiative, and we're really focused this year on trying to support youth as they overcome stigma and try to become more involved in their community. So whether it's through advocacy, program development, and their own personal experiences. So as you'll see the applications come out pretty soon. So if you're interested, feel free to reach out to me directly at arobinson, AROBINSON @nmac.org. Thank you.
Great. Thanks, Ace. Next question, Chip.
This is a follow-up from a clarification from that earlier question about training for the next generation about a particular date and time. Just want to know if they're asking if there's a particular date when that training would start.
So we don't have a specific training. Email me and we can have a more in-depth conversation around what training you may be talking about. So that my
I'm not
email
sure
is,
if they're speaking about another program that we have at NMAC that's separate from the conferences, of course, is Building Leaders of Color. The block program is really focused on uplifting individuals living with HIV who are of color, to making sure that, once again, that they become more involved in their community, and not only just supporting themselves, but working with the Ryan White planning bodies, working with their health departments, federal entities, to ensure that the voices of communities of color, of people living with HIV of color, are fully embedded in the work that's being done within the HIV workforce. Once again, feel free to email me at any time too, if you are if you're interested in that particular program.
great. Thank you, Ace. Next question, Chip.
Will there be a workshop on HIV funding as it relates to services for Black communities? In Chicago and Illinois, Department of Health was found that over $40 million was given for Ryan White. When the RFP came out, Black-led agencies got less than $3 million.
Wow, that's significant.
Yeah. Yeah, so the track on ending the HIV epidemic, that was an extremely important conversation. So I would be very interested in receiving suggestions or submissions for that particular track.
Yep, that sounds like an amazing topic that's definitely needed. Chip, next question.
Sure. Is there any space for a presentation on the NIH HIV/AIDS Network COVID-19 research efforts and the impact on the HIV research agenda of the networks?
Research
Yeah.
sounds like.
Yeah, so I think very similar to the work that they're doing at HANC. So the federal partners, one of them being the NIH and NIAID, are going to be speaking directly to the rebid for how funding is delegated throughout the HIV care and treatment world. And Dr. Fauci and Carl Diffbacher have been very interested in making sure that they're getting that information out to the community, and then also receiving information from community as to what they should be doing going forward.
Awesome. Thank you. Next question.
That was the final question we have so far.
Awesome, awesome. So I'll give you guys another minute because we are, getting up there in the time frames. Thank you all for being here. If you have questions, again, submit them. If you don't have them right now, if they come up later, you're always welcome to email me directly at amckeithen@nmac.org. Hopefully Chip can put that in the chat box so you all can see it and save it and copy it. Ask me any questions that you have. I'm here to help and assist and make sure that you submit the best abstract possible. I want you all to win. So please reach out to me about any questions that you have. I'm happy to give you my best information or pass you on to one of these gentlemen who are on the webinar with me, and they'll give you their best information. But again, visit our website. We have a lot of information about abstract submission and the process with the tracks on our website. Visit our USCHA.life, get all the information about what we're doing for our virtual platform. It's all there. And we're trying to be as open and transparent and as community focused as possible. So, please stay engaged, please stay involved. We have a lot of webinars coming up that will talk all about our platform, how we're coming along with it. We're going to have webinars. If you get accepted, we'll have webinars on how to present, what's needed, how to record, and just make sure that everything is top notch and well done. So we have a lot of stuff coming up. So please make sure you check out all of our webinars that are coming up from NMAC. Chip, are there any more questions?
There are not, no.
They're not. Okay. Well, I'll take that as you guys have received all this information. You've gotten everything you needed from us today. As always, please, please, please reach out to us if you have any questions. In the meantime, take care of yourselves in this COVID environment. Be good to yourselves. You know, self-care is important. And with that, we all say goodbye. Thank you so much for joining us.